So we've had a number of concerns raised about the COVID-19 vaccination. There's lots online, but there's also things we've had locally in the practice as well from patients. One of the major concerns or discussion points is around whether the vaccine is actually safe. So the vaccine has gone through the same process that any vaccine or healthcare product will go through to be approved. We've had thousands of patients who've had the vaccine tested, or the different types of vaccines tested, and those patients have gone through trials as they would have done for anything else. And this has taken sort of obviously the 9 or 10 months we've had the COVID-19 pandemic. And the reason it's come through so quickly, partly is because the whole scientific world and community has been focused on this vaccination because they're keen to get us out of the situation we're in. Significant amounts of government resources and finance have gone into developing this around the world. There's been a massive collaboration and lots of hard work. I think we can be thankful actually that this vaccine has come through so quickly, and it's because of all those efforts that it's happened. We've got a regulator, an independent regulator in the UK which looks at vaccines. They've approved these 3 vaccines, and they would have only have approved these if they were convinced that they were safe for use and the data supported that. So that's where we are at the moment. So another concern is, if I'm fit and healthy, why do I need to have the COVID vaccine? So if you're fit and healthy, the difficulty is that we don't know the effect that COVID-19 will have on you. Now, the vast majority of people who are getting the illness, who are fit and healthy and perhaps younger, are having a mild illness. But there are some patients who are having really quite severe problems with COVID-19. And I've certainly seen younger patients who've had to go into intensive care or need some kind of breathing support. And so we don't know exactly how the actual illness will affect different people. So it's really important that we don't take that chance and we just actually go ahead and get the vaccine done. So after you've had the vaccination, some of you may be wondering about what that enables you to be able to do. Does it relax any of the restrictions that we're currently living through? Unfortunately, it's still really, really important that you keep the hands, face, space rules, so the social distancing, wearing a mask where it's appropriate, and actually restricting your contact with others until such a time that we've got enough people vaccinated and the government gives us guidance that we're then able to actually relax some of those restrictions. The key thing is, though, that we will not be able to relax those restrictions if enough of us don't get vaccinated. That's the likely reality. So we'd encourage you once again that if you're offered the vaccination, you do take up the offer and you do have that COVID-19 vaccination.